President Trump's so-called big, beautiful bill is making its way through Congress. The House has passed the bill and it's headed to the Senate floor to be discussed. Good evening, I'm Casey Getz. News 5's Liam Bridgman has been following this bill and its impacts on Medicaid. He talks with state leaders and healthcare experts.
The Big Beautiful Bill, as it's been coined, contains more than 1,000 pages of tax breaks, spending cuts, and the section that many have their eyes on, Medicaid spending. According to the Congressional Budget Office, the bill would cut nearly $700 billion in federal subsidies to the Medicaid program. This bill, if passed, would also change work requirements for people on Medicaid, something congressional Republicans like Representative Morgan Griffith have pushed for.
If you're able-bodied and you're not willing to volunteer, be re-educated, or get an education, if you're not willing to do some kind of engagement in your community, should the taxpayers be stressed about the fact that you've slipped through the cracks?
This is something congressional Democrats like Senator Mark Warner of Virginia are cautious of.
What this bill does, though, is just devastating to Virginia. About 248,000 Virginians will lose health care.
Warner went on to cite additional changes within the health insurance marketplace and the fear that rural hospitals that receive funding for treating Medicaid patients will shut down. To address these concerns, I went to Ballad Health, our region's leading medical provider, to find out what the impacts of this bill could mean for you and your health care.
Right now, the bill is, in our opinion, in pretty good shape for physicians and hospitals in Tennessee and Virginia.
Tony Keck is part of the leadership within Ballad Health and a former chief executive for South Carolina's state Medicaid agency. He says these potential changes may affect the 15% of patients Ballad serves who are covered by Medicaid, but he says with Ballad's charity care policy, those who make below 225% of the federal poverty limit can receive free health care at Ballad. And he says funding for this program will increase if this bill is passed.
In the balance, and that's why it's a 1,000-page bill, because it gives some and it takes away some, and trying to figure out how that all works up. In the end, ultimately, we think in Tennessee and Virginia will come out ahead.